Right, I'm very happy that two MHCI, a student and alum, can come talk with us today to share with you a little bit about their experience in the program. Hannah Burns is a clinical nurse for UC San Francisco. She's in her final year of the program, will be graduating this coming May. And Eric Bassett is a senior partner at Mercer Health and just graduated this past May, so is a very recent alum. So if I could ask Hannah and Eric, feel free to come on your video and unmute yourselves, and I'll ask you a few questions. So first, Hannah, would you just mind quickly introducing yourself? Anything else you want to say about the work that you do now?
Totally. So like Catherine said, I'm in my final year of the MHCI program. I graduate in May, which I'm very excited about. I'm based in San Francisco. I've been an emergency nurse for about 10 years now, and I've always known I wanted to get my master's. I just didn't know exactly what I wanted to do. And I just knew I wanted a very broad degree. I didn't want to become a nurse practitioner or a clinical nurse specialist. So I just wanted something broad and interdisciplinary. I ended up finding this program kind of by happenstance, working a night shift actually. And the classes spoke to me, the breadth of professors spoke to me, and it's just been a phenomenal experience, truly. So that's a little bit about me.
Yeah, thanks. Eric, you want to introduce yourself?
So Eric Bassett, I'm a senior partner in a consulting firm that focuses on the management, design, and financing of health plans and Medicaid. So we do both commercial work and government work. And I had been looking at sort of advanced degrees for quite a long time, considered and even applied and was accepted into master's in public health programs and other things, but none of them seemed to really hit what I was looking for. And I had some responsibilities within the firm for innovation. And when I stumbled upon this, one of the department heads at Stanford University actually referred me to this, which I thought was sort of interesting. When somebody refers you to a program at another institution, that tells you something very positive. And was very interested. And as previously mentioned, I immediately got a return. That's from the standpoint of things that I learned I began using in my work with clients and special projects as I was learning them. So it was a great experience for me, and I'm still using this now and actually have moved into some other roles where I'm focusing strictly on innovation within my firm. So it's been very positive.
Thanks, that's great. Love to hear it. One of the questions I get a lot is from people wondering how you can possibly manage this and a full-time job at the same time. And all, or at least most, the vast majority of our students are working full-time. So I'll start with Hannah, since you're currently in the thick of it in the degree right now. Can you share a little bit about how you manage, all of your coursework and all of the responsibilities outside of school that you have?
Yeah, in all honesty, it's been very manageable. What I really like about the program is each course is structured relatively the same. You have class about once a week for an hour. You have discussion. Every assignment is due Sunday. Unless there's a holiday, it'll maybe due Monday or Tuesday. So the consistency is very nice. So the last year and a half, I've dedicated just a few hours, probably 3 to 4 times a week, to continue the readings and complete the assignments. And it's been absolutely manageable. Even being on the West Coast, I have a class on the West Coast at around 9 a.m. when everyone else is at noon on the East Coast. So even it's nothing too early if you're on the West Coast. And assignments are due by 9 p.m. on Sundays on the West Coast as opposed to midnight on the East Coast. So it's been very manageable. And we use a Slack channel as well to communicate between cohorts. And that's been very helpful, just to text each other about assignments and everything.
Thanks. Eric, anything else you would want to add about managing
No,
the
no,
program?
I would, Anna, it was very manageable. It took me a little while to get into a routine. I'd sort of try to complete my classwork and my reading and viewing the class lectures and things like that during the weekdays. I travel a lot for my work, so I travel typically Monday through Thursday every week, and I sort of got into a routine of completing those pieces, and then I'd spend the weekend typically, working on assignments, which were mostly sort of written papers, research, things like that. So once I got into a rhythm, it was really much easier. And also, too, I think you mentioned this, Catherine, earlier, that you only take one class at a time. So that's nice as well. You can really focus in. You're not divided between so many things. So that pace worked. Also, too, I think, in the 21-month program, there were some people in my cohort who moved to the longer program. But for me personally, it was sort of great to have that focus and intensity for a defined length of time. And usually you can sort of accommodate, or at least I can, something like that. So if you like working in that way, it's a good fit.
Thanks. And Eric, I'll stick with you for this question because you mentioned it a little bit when you introduced yourself. Can you talk a little bit about how what you've learned in the program has impacted your work?
Yeah, I have responsibility at my work for developing a lot of the consulting content that we use in managing health plans. And I had developed a lot of that content sort of just from years of experience. And I didn't have a formal way of thinking through innovations in the space and how to develop those, how to sort of structure that process from contextual inquiry to sort of rapid testing and then sort of minimal viable product and then implementation and measurement. I sort of stumbled into those things. So I had no formal education around it. And so the greatest thing for me has been sort of using that content to actually sort of manage my day-to-day work at a much higher level and much more consistent. I think the other piece that I enjoyed immensely and has had great application is I've always in my work done a lot of research around behavioral economics, but I'd never had a formal class in behavioral economics. And of some of the classes in the program, those were some of my favorite. The health economics and behavioral economics have a direct application to some of the work that we do. And so getting a more formal base in that made a difference. And this is coming from, I'm 35 years into my career. So you would think, okay, he's an old guy, you can't teach him much new. And it was totally different. It was a lot of new learnings for me and a lot of things that had helped validate that I did before, but gave me a different way of thinking it or processing it or implementing things. So it's been wonderful.
Yeah, behavioral economics is one of the ones that I always hear from alums and students that they end up using a lot. Hannah, could you share a little bit? I know, you're still in the program, you haven't graduated yet, but have you been able to use anything you've learned in your work so far?
Yeah, absolutely. You kind of hit the ground running with this program, and being a bedside clinical nurse for the last many years, I am so patient focused. It's been really nice to use what I've learned in class and, like Eric said, the behavioral economics of it all to kind of expand and look at like where the holes are in the systems, how we can improve, what's feasible to improve now versus later, how to get, who are your stakeholders, who do you need to get buy-in from? And so I've definitely used it within my department pretty immediately.
Great, thanks. And then last question for both of you, Hannah, if you can start. So tell us a little bit about the cohort experience in the program and what kind of network that you've built so far.
Pretty immediately, I knew this was a phenomenal program right during our first virtual seminar. I've been so like hospital based, to expand beyond the hospital has been a truly unbelievable experience. There's lawyers, there's physicians, there's people who have worked at Etsy and Amazon in our program. And so some are clinical, some are absolutely not clinical. So getting and hearing all the different perspectives from people has really opened up my eyes to like, what can I do beyond the bedside? How can I take this? In terms of networking, I feel like pretty well connected with most of my cohort, even if they are on the East Coast. There's not many people on the West Coast, but still, I feel it was definitely a good program for networking. The Penn name, I'm also involved with like the Penn Alumni Association in the Bay Area, which has been kind of fun. Yeah.
Didn't a couple of you end up working in the same building, actually?
Yes. 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 Another gentleman in my cohort works on the floor above me, and we're like the West Coast crew of our
So funny. Eric, now that you've had a little bit of alumni experience, can you tell us a little bit about the network that you've built?
Yeah. I at first I was sort of worried there probably wouldn't be much contact because, like Hannah, I'm quite removed. I'm in Texas, not on the East Coast. But via several different organizations, everything from LinkedIn, there's a group of us that were in our cohort that are staying in touch via LinkedIn on a regular basis and support each other when we post stuff and documents and research and ideas and stuff like that. So that's been fun. And then in the broader Penn community, for instance, obviously in my work, I deal a lot in managed care. And so through this program, I was able to join the Wharton Managed Care Alumni Association. And there I'm getting a lot of contact, not necessarily with my cohort or other graduates from this specific program, but a broader set. So I've been really, really happy with the amount of keeping in touch with my cohort and then the new opportunities too that I didn't really expect to continue.
Awesome. Well, thank you so much, Hannah and Eric. I know you're probably insanely busy, so really appreciate you coming to share your experience.